Hello students, the drug and dyes. We are on the topic of the antihistaminic drugs discussed in last N-aryl anthracinic acid. The structure of the N-aryl anthracinic acid, mefenamic acid, having the two benzene ring attached by the nitrogen atoms. One benzene ring is monosubstituted, another benzene ring is bisubstituted. One benzene ring attached with COH as a functional group, another benzene ring attached with the two alkyl groups, that is CS3 at one to one another. And mefenamic acid is anthracinic acid derivative, where 2,3 xylyl group is substituted at a nitrogen atom. It is used as a mild anti-inflammatory agent and analgesic to give the relief during the tooth extraction. It is also used to treat the inflammation caused by rheumatic arthritis, acute gout, and musculoskeletal disorder. This side effect is caused ulceration in the gastrointestinal tract. What are the cardiovascular drugs? Explain the vasodilator and antihypertensive drugs. We have discussed, I think, these topics. Structure and chemical type and uses of atenolol. Atenolol is the drugs used in the cardiac patients. Generally, it is used for the blood pressure. Patient dealing with the blood pressure or having the problems of blood pressures. Atenolol's structure is the CS2CONS2, CS2CHOS, CS2 NSCS, 3 by 2. Use: atenolol is a beta blocker, that is, it selectively blocks beta receptor present in the heart. It is used in the treatment of angina pectoris and also myocardial infection. Explain the term respiratory stimulant. These drugs stimulate the output of the respiratory tract fluid either directly or by reflex actions. Hence they are of two types, like direct stimulant. Certain volatile oils like oil of the eucalyptus, anise, lemon, cedar wood, as well as the alcohol, when administered by the inhalations with the steam, can be increased the respiratory tracts. Reflex stimulant. These drugs produce the mild irritation of the gastric mucosa, thereby stimulating the gastric reflexes, with help to increase the respiratory tract secretions. Lemon, ginger, tea, or the coffee which contains the caffeine and the theophylline. What is the Parkinson diseases? Give its two symptoms. The Parkinson disease. This is named after Dr. James Parkinson. Parkinson disease is due to the abnormality of the central nervous system and the malfunction of the lower part of the brain. It mainly causes the rigidity in the body, affect the posture, movement, and the speech. There are three types of Parkinson's disease: idiopathic paralysis, agitans, potentiophylatic Parkinsonisms, arteriosclerotic Parkinson. Symptoms: tremor is the most visible symptom of this disease. It occurs at the wrist and is most common in the hands and the arms. As the disease progresses, the tremor may affect the more of the body and or become more pronounced. Rigidity or muscle stiffness results from a shortening of muscles. This rigidity causes the unstable posture and awkward gait. This results in the movement of the limbs. In acute conditions, the facial muscles freeze, resulting in the mask-like facial expressions. In the next lecture, we will discuss the diabetic mellitus.